This is my day. I'm ready to take it on, come what may.
Hey YouTube, welcome back to my channel and welcome new subscribers. We've now reached 100 subscribers, so it's time for me to give you a name and for me to start running things like giveaways. So my subscribers will be called Rafaelitos, and I chose the name Rafaelitos because one of my first trips abroad was to Italy, and while I was there I learned a little bit of Italian and learned that they add ito to names to make them cute. So my subscribers will be Rafaelitos. And yeah, I'll be arranging some giveaways and finding ways to make your participation in this channel, in this journey, more meaningful to all of us. So I'm embarking on a new part of this journey, which is to arrange for attachments for my students at hospitals in Guyana. So one of the things I might have neglected to tell you is that one of the reasons why I came back was to teach medical imaging at the university. So among other things, I specialize in digital medical imaging, my specialty being MRI, magnetic resonance imaging, both in the brain research imaging and cardiac research imaging, that is cardiac MRI and brain MRI, a little bit of cancer MRI. So I've been teaching magnetic resonance imaging and imaging in general, medical imaging in general, to university students here for the last 3 years. And it's now time for me to arrange for them to get first-hand experience in the clinical setting. So I'm arranging attachments at hospitals in Guyana. So they have to do clinical rotations so that they can work with MRI, ultrasound, CT, and X-ray imaging modalities. And so I'm going to go to the hospitals now and interview their staff, meet with the CEO, and discuss whether they'd like to participate in training our new medical imaging technologists. And I would like to take you along for the ride so that you can see firsthand what the healthcare system is like in Guyana. I know healthcare is a big topic in the first world. I know that you're debating whether to scrap Obamacare and introduce Trumpcare in America. And while I like to encourage people to move back to Guyana, so if you're about to retire or you're looking to start companies like I did, there are opportunities in the developing world where you can easily start a business and grow it and expand and get experience which you can utilize once you move back to your developed country. But one of the issues you have to deal with, when you move to a place like Guyana, is the healthcare system. If you already have health issues, then it's a challenge that you have to address immediately. And if you're retired but you're still healthy, it is one of those contingencies you have to plan for. So I will introduce you to the healthcare system in Guyana. So we'll go to some of the private hospitals and the public hospitals so that I can show you around and you can see how the facilities are laid out and how care is delivered. And then you can have a better idea, better understanding of how quality of healthcare and how healthcare might be available to you when you move back to Guyana. And I'll give you some ideas, some tips on how I deal with health issues in Guyana. Alright, so stay tuned and I will give you my personal tour of the healthcare facilities, hospitals in Guyana.